CDC director and the vice president's doctor put out statements last night saying the vice president is not a close contact with anyone who tested positive for COVID-19, including President Trump. We saw him sitting within 6 feet of for a prolonged period of time in the Rose Garden, directly in front of Senator Mike Lee, who tested positive. The CDC says he's not a close contact because that was more than 2 days before the onset of symptoms or a positive test. So help us understand, when are people most at risk of becoming infected?
So generally speaking, from about 2 days prior to the patient becoming symptomatic until about 5 days after their last fever, provided that they are improving and are not experiencing severe respiratory complaints. So it's a broad range, and we have had mixed messages about the timing about this particular outbreak. So I would find it very hard to believe that Mike Pence was not in close contact with any of the 12 plus people that are now confirmed to be infected. It seems very unlikely that he didn't come into close contact with all of those people that were not wearing masks.
The vice president, according to his doctor, has tested negative both via antigen and PCR tests. I think the most recent PCR test was yesterday. We know people can test negative for days and then test positive. We look at Stephen Miller just yesterday. But at this point, would it have been in the vice president's system long enough to show up on a test if he was exposed at the Rose Garden event or even in a meeting with the president early last week?
It's still not completely out of the window in which he could turn positive. We've seen patients go up to 14 days and turn positive, 14 days from the exposure, that is. And so, if anyone else in America had experienced this type of an exposure, we would be instructing them to quarantine and to be completely, strictly quarantined at home. So it's been very surprising to see the way they've responded to this outbreak.
Just really quickly, the CDC director says it's safe for the president to attend tonight's debate. Do you view it the same way?
I think they have done a lot of things to increase the safety. They have moved the candidates further apart. They have erected a plexiglass barrier. I know that the Biden campaign has been very careful following all CDC recommendations and masking consistently. So I would hesitate to say that it's not safe. On the other hand, it seems like one of those things where why take any risk if it doesn't need to be taken. Certainly the debate is important, and we need to hear the point of view of both candidates. All of the American people would like to hear this debate, but the health and safety of Americans, including our leaders, has to come first. So I hope that they are following all of the guidelines. It sounds like they are. But there's no zero risk scenario here.